Good morning. Two things. One, yesterday I missed sending you this PDF, right? But no worries. Today we'll complete the whole topic and then it would be sent to you. Second, quite a large number of emails were received regarding the last dissected part. That will we be doing such dissection? Well, no. No, practically, I'm very much doubtful about that whether this type of dissection would be done, because see, these are called as the samples, right? These are called as the specific specimens. So what really happens is then the head is taken, right? One query was regarding how this was the reference means how is it taken. So see, consider that this is the head of the cadaver, right? So the section was taken right in the middle, like this. Exactly, right? With a saw, exactly the section was taken like this. And what you watched was the half portion is removed, and then you are watching it, right? Now, so what really happens is these are the specimens which are possible only for the museum. Practically you won't be doing it because it has to be done with a tremendous power and with utmost precision so that the whole thing is dissected very properly, right? Okay, so that's the reference. That's how this above section was taken. So it is absolutely a midline section, right? Sagittal section. That's right, sagittal section. And then you are watching it. So you are watching all the structures, right? So this is exactly like the side view or the side profile, right? This is the nose, right? This is the nose. These are the lips, right? This is chin and the neck. Right. That's how the whole thing is. And yes, definitely, as you go above, yes, you'll be able to see even the orbital cavity and above the brain, etc. Right? So when it is there, but only the small portion is shown over here. And don't worry, when we'll be doing head and neck, in fact, its videos, they are already there. So even this structure is explained in tremendous detail. Okay, so let's start with our next section. Now today's section, this is the lower limb, right? This is the lower limb which we are now starting. Bones of lower limb. Actually pretty important, especially if you are into fitness, because it said that we do good exercise of the upper body, right? You must have noticed people do good exercise of the upper body, but the legs are like chicken legs, correct? People do lots and lots of powerful exercises for chest, right? But the lower legs, right? If you really see the thigh muscles or the calf muscles, they are very weak. So that's the reason when it comes to say many of the bodybuilders, you tell them that come on, let's run for 2 kilometers. No, they won't be able to, right? Forget about the marathons. But say what I really want is, so because you all are medicos, you understand that what type of body should you be having. One word, efficient, right? Your body should be efficient, right? Not yesterday was leg day. Okay, I mean, so efficiency of the body is more important. Now efficiency, it is in two ways. One, power, and second, endurance. Endurance means the ability to run or perform the action for longer duration, right, without tiring. So it is not only the muscle power, but it is also your cardio respiratory efficiency, right? Cardio respiratory efficiency. Because see, as I think one of you is also preparing for half marathon, right? So that's very nice of you. So you must have noticed that when you try to run, at times it happens like say after some time you either your breath starts breaking, right? Your respiratory rhythm starts breaking, or there is pain in the legs. So today we'll be discussing so many important points about it, and that will give you a very good idea about what exercises one should perform every day. Trust me, every day. Don't worry, it is the same PDF, because once we'll save this PDF, right? I'll be sending it today, so it comprises of everything, yesterday and today's session, right? So you'll get it. All right. So here it is. So that's our, these are our lumbar vertebra. Does squat really boost testosterone levels? Well, uh, I'll talk about it. I'll talk about it. It is other way around. It is other way around. So why those six hormones, testosterone in case of males and estrogen in case of females, why they are so important? Because they actually give the muscle power. They actually give the endurance, right? Now, say, do remind me. Let's finish it, our today's topic, and then if the time is left out, we'll talk about it. Else, tomorrow is our day, right? Saturday. Tomorrow is our day. We'll talk about it. But yes, this is a good question. It's a good question. Okay, so lumbar vertebra, right? That is one. That's our innominate bone, right? Innominate, or in simple words, hip bone, right? Or the pelvic bone. Pelvic bone. Nothing. For PDF, I'll be putting the link into a comment section as well as in the description. You just click on it and this PDF will be yours. Right? So nothing much is to be done. All the links, they are like that only. You just click and that's it. It will straight away be reaching you. And this smiley, can you figure out? There is a nice smiley, right? And that smiley, see here, right? This smiley, this one, right? And that is sacrum. So that is sacrum. Then there are various names, ella of sacrum and this sacral promontory, etc. But all those things we'll study when we'll be discussing the specific regions, right? And this is coccyx. Over here, back to this. Grossly watching this one. So this is sacrum, right? That one is femur. On top of it, that is our largest sesamoid bone, that is patella. This one is a very tough bone, tibia, and this is a very feeble, delicate bone, fibula. Over here, there'll be all tarsals, and these tarsals, they are really very interesting, and we are very much interested in them, because these tarsals, they will be, you'll see that how beautifully the entire this ankle joint and how we really run, which are the bones which are taking the entire impact. And obviously then there would be metatarsals, and finally the metatarsals, they are more or less like metacarpals, and the phalanges, right? Quite similar, right? That is easy. Tarsals, worth watching, worth understanding, and worth even say remembering. Okay, so here it is, just a zoomed view, and zoomed for this reason. This is head. This is head of femur, right? Head of femur. How deeply, right? How deeply this head is penetrated into the acetabular cavity, right? Because that would be the acetabular cavity. So as we said that over here, stability is important, correct? Over here, stability is important, and that's why there is deep acetabular cavity, deep acetabulum, right? Ankle is a joint, right? Not only the tarsal bone, it is, you'll see. But yeah, tarsal is the main one. So deep acetabulum, right? That's for stability. So what we now do is watch for this real bone. This is real bone, right? Not the graphics. This is a real bone. And hip bone is combination of three bones: ilium, ischium, and pubis, right? Ilium, ischium, and pubis. So over here, if you see, if you say stand in style, right, with both your hands on your waist, right? You got my point? Because if we stand in style, right? So both our hands on the respective waist, so then the your hand, your entire say this hand is on this iliac crest. It is called as the iliac crest, right? And all of us sit on ischium. So this is a posterior structure, right? Yeah, Shaktiman position. Yeah, femur head is deep in acetabulum of both male and female, or is it? Well, acetabulum to is deep in both the cases, but female pelvis is usually wide, right? So that's why there is difference in the angles, right? There is difference in the angle. At the same time, there is difference in the flexibility. That's the reason when a male walks and when a female walks, there is a difference, right? And as such, so there are quite a number of differences, right? Acha. So ilium, ischium, and the pubis. Pubis is in front, right? And the pubis. See, this is acetabulum or the acetabular cavity, right? Acetabular cavity. And it is in this cavity the head of the femur would really fit. This will give you much better reference, right? Much better understanding. So see, here is the iliac crest. Iliac crest, right? Pubis is in center. So this is where the joint bit both the pubis, right? Both the pubis they join over here, and that's why this particular joint, this particular joint is called as the pubic symphysis. A new word, pubic symphysis. Symphysis is joint. Hip joint called acetabular joint? Yeah, you can say that, right? You can say that. So that is the pubic symphysis. And this is ischium, right? That's the ischium. So I'll write it over here, ischium. One single sentence, that we all sit on ischium, right? So that is the portion on which the humans really sit. Fine. So that is one more thing. Say if you are standing like this, right, with both your hands on the hips, so then your tip, right, this one, right, this one, your fingertip is on a very prominent point, right? Let's take it over here. It's on a very prominent point, this one, right? If you try to feel immediately, you just try to feel immediately, you will feel this point, a very bony prominence, right? Just in front, right? Just in front, you put your hand like this, and with this finger, just feel, and you'll feel a very prominent point, a very bony, solid, prominent point. It is called as, it is anteriorly situated, correct? So anterior, right? Superior iliac spine, right? This is anterior superior iliac spine. So that is it means that there must be something like posterior superior iliac spine. Well, that is on the back side. But yes, was that previous image a posterior view? Which one? This one? Well, you can say that. Yeah. In fact, it's not posterior, it is bit of lateral view. See the acetabular cavity, right? Acetabular cavity will be projecting lateral side. So that's why we are watching it from the side. Right? So you can get a reference from here, right? So as if we were watching that from this angle in previous image. We were watching that hip bone from this particular angle, this angle. Okay. Right. So that is anterior superior iliac spine. Just I'll be telling you one or two names so that you start getting comfortable with it. Next is, right, that's the femur, right? That's the femur, and then it will be forming the, say, above the hip joint and below the knee joint. Hip joint, the femur, the longest bone, right? Femur is considered as the longest bone and the most powerful. Pretty powerful. Let's see it closely. Now, this is a real image, right? Now, whether this is anterior and where can we see the coccyx? I think, see the coxal bone means coccyx. Are you talking about coccyx? Okay. Say this is a real femur, right? So this is one image and this one is second, right? Same femur. It is the same femur. One is the anterior view, second is the posterior view. How will you decipher? Let's see that. Now you remember, in case of humerus, there was like greater tuberosity, lesser tuberosity, right? Over here, it is still bigger. So we'll call it trochanter, right? The new word is coming up. It is called as the trochanter. Because bone is big, so that's why trochanter is like a mountain, right? It's like a mountain. So here, this one is so prominent, so we'll call it the greater trochanter, right? We'll call it a greater trochanter. And this one would be, correctly said, lesser trochanter, right? Greater trochanter and lesser trochanter. Another one very important and outright we should be able to see, and we have even discussed about it, and this is what is called as the fovea, right? Let's give him complete name. It is called as the fovea capitalis, right? Fovea capitalis. So exactly on the head, and this will be having, yeah, that's right, and this will be having ligament of head, right? It has to be ligament, right? It has to be ligament. So this is ligament of head, because this entire thing, almost this much, right, will be covered into acetabular cavity, and that's where this ligament would be formed. And this ligament will provide stability, that is one, but it is also consisting of one very important thing, and that is nutrient artery, right? That is the nutrient artery of head. In case if this nutrient artery of head is broken, right, if it is damaged, maybe because of some dislocation or maybe because of any of the other injury, it will lead to one condition. What is that? In which head of the femur is destroyed because of damage to nutrient artery. Erosion of bone, okay. But do you know the exact condition? Right? We have discussed that thing in past. That's right. That's right. It is avascular necrosis. Perfect. Right? It is what is called as the avascular avascular necrosis. That's right. So avascular means because of the lack of blood supply, and necrosis means that erosion or the destruction, and that leads to, when you take the X-ray, right, you will find the lucency in that area. That means the blackness. Because see, X-rays, when the bone is present, bone appears white, right? So when there is no bone, so it will appear black, dark, right? So that's the reason why it is like that. Trochanter, you tell me, what was there? It was tuberosity, right? That's why it was intertubercular sulcus. So the greater tuberosity and lesser tuberosity, and in between there was intertubercular sulcus, right? Over here it is greater trochanter and the lesser trochanter, right? The barb of that tubercle, much bigger. Right? So that's what is homologous to trochanter. Now see, this is anterior. Now the moment you will see posterior, instantly you will come to know that yes, it is very easy to differentiate between both of them. This is anterior view, right? This is anterior view. What do you want me to explain again? Avascular necrosis? See, this is posterior view. Let me know, I'll cover it up. Right? So this is posterior view. Now in posterior view, here it is. See, it's so prominent. That's the greater trochanter. Correct? And this one is lesser trochanter. Lesser trochanter. So very nice, right? Now, okay, I'll take that. And in between both of them, there is a fine crest, fine margin, fine bone, right? A very sharp ridge. This thing, right? This is what is called as the crest. It is called as the crest, right? So it is called as inter, between two trochanters. So trochanteric, intertrochanteric crest, right? So that's again a new word. So intertrochanteric crest. Remember, intertrochanteric crest is seen on the posterior aspect, right? That is so important. It is seen on the posterior aspect. One another thing. Now visualize. Think it like that our biggest muscle in lower limbs, right? They are the gluteal region, hip region, right? Those muscles, gluteus maximus, gluteus medius, and gluteus minimus. Those three muscles, they are in layers. And those are the muscles which are responsible when we are, say, going uphill, or when we are walking, running, power, right? Why you do squats, right? Why it is so important? Why these muscles, they are not important only for the running, even the core muscles, they are important. What exactly is a Kegel exercise? Why every male should means male, why not only male, even a female should really do these exercises, right? For all answer of all these, visualize a bit, and because I'm about to show you one very important landmark on this bone, right? I could have said straight away, but once you'll visualize, you'll be able to understand it very clearly. This is a posterior view, right? This is the posterior view. So that means the muscles which will be attached over here, they all will be on the back side, right? They will be on the back side. Are you getting it? Right? They'll be on the back side. So over here, right? This is anterior view, right? This one is anterior view. What we are watching is the back side of this bone, back side of this bone. So obviously they'll be going towards the hip region, right? And the hip region is also called as the gluteal region, right? It is called as the gluteal region. So over here, can you see a very rough, very solid area over here? This one, right? Clearly you can see that it is pretty rough. This one, I'm talking about this area, right? This area, right? Now I remove this so that you can appreciate, right? See, pretty rough, right? It is rough because very powerful muscles, they'll be connecting to this, right? And that is because of that, it is called as the gluteal tuberosity. This gluteal tuberosity. So now it makes the complete sense that those gluteal muscles, they'll be connecting over here, and that's why, because they are powerful. So here it is, which leads to this prominence. Again, when we were learning about the bones, we said that all types of stress, right, compressive strengths, right, shear, tensile strengths, they lead to development of this bone, right? This is the thing. Fine. Okay. Pranav, I say it won't be very nice to say compare or insult any of the teacher, but say, I'll tell you about phobia capital. Say regarding, just think it like that every teacher will be having their own style, right? Because I don't like PowerPoint. So in any of my sessions, you'll always find that I write and explain. Yes, sometimes it is said that it takes half an hour extra. Agreed. I completely agree. क्योंकि लिखने में थोड़ा time extra जाता है. But that's how I have learnt. That's how all of my students have learnt. More than 10,000 students have learnt, medical students. So whether it is when I teach them engineering, if I'm teaching them about the IP address, so I literally write that, okay, this is IP address, which is a 32-bit divided into 8.8.8.8, right? 8 bits each. And this is the first octet. I literally write. Now, same thing can be done in the form of, say, PowerPoint. Well, PowerPoint is used in most of the cases. I don't like it. So I won't be able to answer, or I won't answer this question, Pranav, that जॉर्जिया में फिर से पढ़ाएंगे या ऐसे पढ़ाएंगे या कैसे पढ़ाएंगे. Well, it is difficult, right? So forget about it. What I feel is, when we are studying, study it. Then whether it is taught again or it is not taught or whatever, right? Don't worry. Right now we have got a chance, so we study, right? My intention is only one, that by the time when you go to your universities, right, you are completely ready. You are completely ready, right? So you are, and obviously we all will be connected over here, right? So at any point of time, you can always, you have got the mail, right? You can always send a mail. Yes, because of that bad COVID and plus some other problems, right? I was almost out of touch for a year, right? But now I'm back. Now I'm absolutely fine. So don't worry, right? And definitely that's why it was like till you are MBBS, right? With you till you are MBBS. So don't worry. Uh, so that is the gluteal tuberosity. Because when the bone will come in your hand, this thing would be of great help. And obviously that one, this is a long bone. So we'll call this as a shaft, right? Shaft of the bone, and then the head end and the lower end, which will be forming the knee joint. Very, very important joint. Very important, right? It is this joint which will come so much in your practice also, right? Even in private practice, this joint, because this is the joint which is what is called as the weight bearing joint. Weight bearing joint. Now you must have noticed that your means, I wish your parents, but your grandparents or some neighbors, right? They keep on complaining about that there is pain in the knee joint. Even few of you gentlemen, you also told me about that you are having knee pain, joint pain in the knee joint. Now take care of it. Take extreme care of it. I'm about to tell you one very interesting concept. Can you believe that if someone is having knee pain, right? If someone is having knee pain, what is usually said? Yeah, say, yeah, grandmother. Yeah, if it the pain is in tarsal, yes, Meet will come to that, right? When we'll be talking about the tarsals, right? So right now we'll not be talking about tarsal, but focus on the knee pain. I'm about to explain one very important concept, and this is what I really want that all of you should start doing it from today, right? The thing is, if someone is having knee pain, normally what everyone tells, Are, take rest, right? Daudo mat, chalo mat, just take rest, right? That's what it is said. Yes. Old age kya? Me, what old age? I means few of them, even in their 20s, they start getting the knee pain. Now, why that knee pain comes? Knee pain occurs only when, because if it is occurring, that means this joint is compromised. It is compromised because your muscles are weak. So those who are having knee pain, if their muscle power improves, right? The moment the muscle power improves, you'll find that knee pain, it disappears. Calcium deficiency, excellent, right? Just before few days we talked about calcium and the vitamin D3. These two are vital, right? That is the calcium and vitamin D3. Now it usually happens that in Indian female, right, they'll take care of their kids, they'll take care of their husband, but they'll not take care of themselves. So at one point of time, because of sharp decrease in the D3 and the calcium, their yeah their muscles, I'm sorry, their bones, they start getting weak, and that's where all these problems they start occurring. What one should really do is improve your muscle power, because if your thigh muscles, hamstrings, right, just behind the thigh, calf muscles, they are powerful, they'll be able to handle any of the knee pain. Else, think it like those who are running marathons, right? So their knees, so they should be totally eroded, na? Means say for example, I have run about 100 races, right? Few of the races, they were like 65 kilometer, 80 kilometer, right? Even that long in overnight, in one night, 88 kilometer. But average, let's put it 42, right? Even if we put 42, it comes to 4,200 kilometers just for the race. Practice is different, right? Say tomorrow, when we'll be meeting, tomorrow target is 35 kilometer, because just then only I'll be having just 10 more days, 10, 12 more days, and for that full marathon. So 35 kilometers. So the weekly target is usually about 70, 80 kilometer. So if you consider that, right, so by the time you reach to this level, the knees are gone. You reach Russia, yeah, that's right. That's right. But if you calculate the total distance na, so it is like I have पूरे अर्थ का एक चक्कर मार लिया है. I have reached USA. Right? This is the distance only in marathon. The practice thing is different. So the thing is, I'm about to show you, about to explain you some exercises, because we have got enough time today. It's just few things are left out. All of you, all of you must, and yeah, without a USMLE, without USMLE, पूरी अर्थ का चक्कर. Yes, I am planning to take test. But see, Ashwarya, we have got the options. Even you guys can say, tomorrow we can either plan a test or we can plan like a free day, right? Free day means, say I have got few mails, and say one very much in demand topic was time management, right? So many friends, they have said about the time management. क्या पता ही नहीं चलता time कहाँ waste हो रहा है, right? So we can take this, and say regarding the exercise with the question which was asked, this one, and plus there are some other points. So free day plus test, how to do that, right? How to test means it is full 1 hour, right? It is full 1 hour. Yeah, meditation was also one of the point. Your joint doesn't pain? No, not at all. जरा भी नहीं, बिल्कुल नहीं, बिल्कुल भी नहीं. And my record is like 4 hours. Within 4 hours, finished the full marathon, right? 42 kilometer. So at this point of time, my capacity is that non-stop from start 17 to 18 kilometers, right? Without a single break. Then then I take some water, means walk for about 200, 400 meters, half a kilometer, and then the second spell, right? Which is of about 10, 12 kilometer. So this takes me to about 30, 32 kilometer. After that, it is combination, right? You run for 2, 3 kilometers, you walk for half, and by the time when you reach 35 kilometers, it's so hot, right? Because sun is almost on the head, right? Races, they start at around, say, 5 o'clock. So by the time when it is 8 or 9 o'clock, 8 o'clock or 9 o'clock, it's quite hot. So then the efficiency goes down. Average speed is about, so my speed is about 10 kilometers per hour. So every 6 minutes, 6.5 minutes, I cross 1 kilometer. Okay, so moving on to this. Yes, so I think we'll keep, not to worry. Tomorrow we keep it a free day, right? We'll talk about all the topics, whatsoever you say, right? Extempore, will keep on discussing. ठीक है? And that would be fun. ठीक है यार, रोज रोज क्या पढ़ाई करनी, right? One day is it should be a free day. Even in food also, I do it like that. One day मतलब eat lavishly. And it's not so मतलब I do only अच्छी अच्छी बातें, right? I eat pizza also, right? क्यों नहीं यार? But not regularly. But the day you have run 30, 35 kilometer, अरे क्या cheat day? अरे it is not a cheat day यार. Why to cheat? Right? It is a happy day. I don't say it a cheat day. It's a happy day. Yesterday it was a sad day. You know why. Okay. मेहनत का पिज्जा डे. That is good. मेहनत का पिज्जा डे. अच्छा. Now as we are, yeah, Parsh, you agree with me. Now see, this is a bit of controversial thing, right? But because you guys, you are quite mature, and you will be able to understand what I'm about to say. See, any amount of money, seriously, any amount of money is completely useless, right? I'm about to say a very blunt statement, and yes, if you tell this thing to anyone else, right, they'll feel insulted. But yes, it happens that by the time people reach to their 40s, right, they are literally useless. Those males, they have got no capacity to make their female happy. You understand what I mean? Seriously. And at times, though, it is even less. It is vital for every male, and it is vital for every female to be absolutely efficient sexually. Yes, this is important. And that is the reason that these exercise, right, these exercise, they are like an investment. Was they are like an investment. Right now you are in your 20s. But if you do proper exercises, you will be relishing your life even when you'll cross your 40s and 50s, right? How many of you seen the movies of James Bond, right? My favorite character, right? 007 James Bond, right? You watch his or her movies, right? James Bond. Now, see their efficiency, see their fitness level. Now, this thing will never come in, yeah, 007. This thing will never come overnight. It is a consistent practice, right? Not until must watch, right? The plot is good, technology is good, and And say uh, people won't say appreciate you, right? No Time to Die, so it is last movie, right? But otherwise, say Tomorrow Never Dies, one of the very fine, Golden Eye, very fine movie. Okay, so here it is, all of you from today, right? Yeah, from today, one, squats, right? Squats, just 10 squats, just 10 squats a day. I'm not telling more, right? I'm not telling you कि चलो tomorrow you run 10 kilometer. No, because otherwise there'll be accumulation of so much of lactic acid, so it will be a problem. But start doing this much exercise, if not more. Squats 10. When you do the squats, right, everyone will be doing squats like, say, knees bend, and then, right, standard, as if you are sitting on an invisible chair, right? Without weight, you do it, right? But the only thing is your knees should not cross your toes. Remember that. Otherwise, you'll be damaging your knees. Why you will be damaging your knees? That we'll see when we'll be talking about knee joint in depth, when we'll be talking about meniscus, right? Lateral and medial meniscus, and what really happens when you do it incorrectly, right? But just 10 squats, right? Non-stop 10 squats, not even 3 sets. I'm just telling one set, right? Say, Shaunak, if you are doing more, well and good. This is for someone who is just starting or who has not yet started doing the squats. Just 10 squats a day. Keep on talking, then I'll keep on telling you that when to increase or when you can add the weight. One is the squat, and second is skipping, skipping ropes. So for example, my speed is, I do at the rate of about 170 skips per minute, right? You won't be able to see the rope. It goes by tuck, 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 tuck. It goes that speed. And so 500 skips non-stop, right? And such 2 sets are done, so it becomes 1,000. When you do this, this is one of the superb exercise for your leg muscles, because your leg muscles, they'll be literally bathing in blood, right? There'll be so much of, say, vascular improvement. And when you do squats, it gives you power. Now if you are going in gym, then there are equipments also which are meant for the leg exercise, but yes, don't avoid it. The way it is said that leg muscles, they are bigger, so you can do it on alternate day, right? Otherwise, say normally you will be told that what's the pattern, right? The pattern is, they say, upper body, lower body, abs, give a rest, then upper body, and so on. So no, don't do that, because see, for upper body it's okay, these are relatively small muscles. Lower body and the abdomens, they are huge muscles. You don't have to give them so much of rest, right? For the proper balance of the body, do lower body exercise every alternate day, right? That much time is more than enough for the lactic acid to degenerate, and then you are fine enough. The advantage would be, as you will cross the age, your efficiency would be equally high. Because yes, these exercises, plus there are so many few other exercises also. Oh, 326 skips in school life. Okay, that is impressive, because I maximum I did, means you did it for 1 full minute. That was 326. Okay, because then it is very good. Because I went for a high speed. No, I trust you. I trust you. Athletes always trust another athlete. My record is where I did it. I tested it for 30 seconds. In 30 seconds, the highest which I've done is 140, 141 or 142. Right, 142 was the highest in 30 seconds. So that comes to 280. Still, I'm less than you. this is my current speed, right? 170 minute, keep on doing 500, then 30-second rest, and then go for another shot of another 500. So total 1000. Do these two exercise every day, every day. Yes, I do plank. I can do plank for about 4 minutes and 10 seconds. Because plank gives your support to your core muscles. Crunches, I'm not advising you right now, because crunches we do it in a very wrong way, very wrong way. Right? Crunches we do it in a very wrong way. We do dhar high speed crunches, right? So no, crunches, they are to be done at a very slow pace. When you do it at a very slow pace and plus watching towards the sky and gradually you do it, that's where you'll find that doing even 20 crunches is more than enough. But this is what I wish to say, that start doing some exercise, right? And that will make a huge difference. Okay, moving on to, this is a knee joint which I'm showing you. Side determination. Which side this knee joint is off? Right knee joint or left knee joint? Right? Right knee joint or left knee joint? Arey, please don't do this advertisement part right now. This Insta is this and group and everything. Because unnecessary, I have to stop you then. Don't do it. So side determination. This is right knee joint or left knee joint? Right? Think it like as if this person is standing in front of you. Right? Person is in front of you. So how will you determine? Think it like I said that this one is what? Tibia. Tibia is a bigger bone, correct? Tibia is a bigger bone. Tibia is a bigger bone, so this will be the side where there would be the big toe, right? Big toe. So hey, this one would be the big toe, right? And then all those fingers, they will be going like this. So if this is the position of the foot, this is right side or left side. Person is standing in front of you. Right, right. Okay. Left, right, left. Okay. Okay. What about others? Okay. Okay, Akshata, right. Aditya, right. You're right. You're right. See, here it is. Think, watch this. Right. This person is standing in front of you. So here is the big toe, right? That's the tibia, right? That's the tibia. So you are right. This is right, right? That's the right side, right? So Risha, not left. Think it like this, right? I explain again. So on in his opposite leg, see, let's watch. Yeah, here it is. If it is there, if it is there, no, we don't have that. Both the legs full-fledged. But at least this. See, over here, right? This one is tibia, this one is tibia. So his big toes, they will be like this, right? Big toes will be like this, and then like this. So this is a person who is standing in front. So that's the right side, and this one is the left side. Good one. Let's see some parts, important parts. This one is patella, correct? That one is patella. Now, one more new word. This is called as condyle, right? See the curve, big, graceful curve. This one and this one, right? So that is called as the condyle. Condyle. Good. So here also it is condyle. So which side is medial? If I'm just putting the mark, this side. This side is medial or lateral? This side, the where the red dot is put, it is medial or lateral? accordingly we'll give the name. This is medial or lateral? Medial. That's right. That's right. This is medial. So we'll call this as a medial condyle. Medial condyle. So obviously this one would go as a lateral condyle. Correct? And this bone is fibula. So fibula is situated lateral side, on the lateral side. So that matches. Now over here you can see it immediately that fibula is not taking any role, any part into the knee joint. Right? See the entire femur. That's the femur. Femur is in close approximation with the tibia. So they both are forming the joint and the patella is helping out. Right? But fibula is on the side. Right? So remember this part. As we'll be going into depth, you'll find that then they are called as the meniscus, right? They are called as the meniscus, lateral and medial meniscus, right? And these are the meniscus which are actually acting like a cushion, right? But when the muscles are powerful, so these powerful muscles, they'll be holding the thigh, hamstrings, and at the same time strong calf muscles, they'll be holding this knee joint very properly, and that is what gives endurance and the power, right? You know about, there is one very interesting exercise when you want to run fine, right? It is called as high knees, right? You jump like Hanumanji, right? So one high knee, second high knee, you do it just 20 steps and you'll find that your heart rate will shoot over 150. And but it is one of the very fine exercise for the legs, right? You start with say 10, don't get over exhausted, right? But if you can do it 50, so then you just tap your back, right? Give shabashi to yourself, because if you can do 50 these high knees, right, in army, that is what is done. If you can do that, right, that will improve your performance to another level. So here it is. Achha, chalo, let me ask you one interesting question. Here is one very important point, right? And let me mark with red. This one, right? This point. A muscle would be attached over here. A muscle, very nice muscle. This muscle, right? If this is the thigh, right? So it is like this, and when you are taking it towards the center line, so which movement is that? So if we take it in the hand, form of hand, this movement is what? And this movement, yes, that is adductor, right? It is called as adduction. And this point is called as adductor tubercle, right? It is called as the adductor tubercle. Tubercle means this is small elevation, right? But the adductor muscle would be connected over there, right? So going away is abduction, and when coming near, it is called as the adduction. So this is called as the adductor tubercle. Yes, you are right. There'll be, that's right. Next is, as we go below, right? This is easy. So this one is fibula, and that one is tibia, right? The right side. This is like a real, these are real bones, right? See how are they? Here comes our very interesting area, and that's the ankle, right? That's the ankle. This portion and this portion, you touch your ankle on both the sides, right? There is elevation, right? On the medial aspect, on the and on the lateral aspect, there is elevation. You can feel that bone, right? They are called as the malleolus, right? They are called as malleolus. This is also called as malleolus. So easiest thing to describe would be just say it in the form of medial and lateral. Here is the big toe, right? That's the big toe. So this side is definitely medial. So we call it medial. Now onwards, instead of writing medial, we'll just write it like this, right? To develop a habit. So this would be over here. I'll write it for one time. It is medial. And when we do it like this, so we'll call it lateral. Not to be confused with left, because when it is right, so we do like this. And when it is left, we do it like this, right? So that is for right and left. So this is medial malleolus and the lateral malleolus. Squats can be said as extension. Means as such, to it is flexion, but when you come back, it is for sort of extension. Tomorrow we'll talk more about it, or today, if the time permits, we'll talk about it. Achha. Now see, this is the bone, ankle joint, right? As someone was telling, yes, you are right. This is a talus. This bone is called as talus. So this one is tibia. This tibia is in close approximation with talus, right? They both are over there, right? Now, in the side view, we'll see that how this talus is located. Meantime, all of them, these are metatarsals, right? These are the metatarsals, easy. And then obviously these are the fingers, all the phalanges. Like upper limb, over here also phalanges are say 14. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 and 14. So there are 14 phalanges. Right. To make our understanding more clear, let's watch it from the side. This will be giving us very fine picture. See this thing. While running, if you are having pain, one, in the heel, right? If there is pain in the heel, so then that pain is into this calcaneum. This bone is called as the calcaneum, right? Calcaneum. When the pain is in calcaneum, that means there is it is called as the tendo Achilles tendon over here. You can feel that, right? On the back side of your ankle, you just feel that there is a very tough structure, right? Which is starting all the way. It is tendo Achilles, right? It is tendo Achilles, or also called as Achilles heel. This is connected with the calf muscles. The moment your calf muscles, they are powerful, right? You'll find that this pain will start disappearing. So weighted leg raise and then taking them back slowly. So never, when you are doing exercise on the gym, never do it at a high speed. Do it at a slow speed. 1, 2, 3. Because that way, gravity is trying to take it down. But you are slowing down the process, so you are engaging both the group of muscles. So it leads to overall development of your muscles. And then you just do 3 sets of 25. Bas, enough, right? You do 3 sets of that exercise today. That is the leg raise against the weight, and then take them down slowly. Then once again lift, then take them down very slowly, right? Do it. And then next morning, do some stretching and then run. See how effective your run is, right? For the calcaneum, in case if there is pain, you'll find that this is also called as the arch. This is arch of the foot, right? Before you start running, do this test. Wet your feet, and on newspaper or any of the surface where you put your footprint, and you should be able to see that yes, it is giving this type of shape. This type of shape. And not this type of shape. If it is happening like this, then that means that person has got flat foot, right? that is flat foot. So take extra care. Flat foot is usually because of poor muscle power, and wrong posture when you don't walk correctly. Yeah, having arch is very good. In fact, arch should be there because arch gives grip. Arch gives grip to the ground, right? So it acts like a spring. It acts like a spring. So when you are running at a high speed, right? So it is this arch which is acting like a spring action, and which pushes you for a bigger leap, right? Which pushes you for a bigger leap. So you'll be surprised if you walk very fast, your heart rate goes high, but when you run, in fact, it is not that high. It is much under control. If this curvature is high, well, I need to see the x-ray. How much high, right? How much high? Because too high is also not good. Coming back to this calcaneum. So this is, if anyone is having pain, say in such case, the calcaneal massage is very good, right? Pressing at the just on the heel, right? You'll find that if the pain is there, you'll feel so comfortable and so good, right? This is one. You feel good as this is the entirely a padded structure, right? Over here there is lots of soft tissues. So when the pain is there, pressing it, yeah, acupressure sort of thing, so it gives quite a relief. So this bone, now you know the name of the bone, calcaneum, and the bone which is over there, that is what is called as the talus, right? So this one is tibia, right? This one which is talus, right? So we know now tibia, talus, and calcaneum. Yeah, there is the pressure point on arch. We'll talk about it. Now, immediately to the talus, this bone, right? See, I'm highlighting now only that bone so that you there is total clarity about it. So here it is, right? Here it is. See this one, this which I have highlighted, that one is tibia, right? Then in between it is talus. In between is talus, and this highlighted structure, right? It is navicular. Navicular, right? Ah, many people use high heel sandal, right? Now the answer of this is one girl only answered this question. Means when I asked, she said, I said, see, high heels, they are very actually damaging to the calf muscle. But she said, well, sir, I won't mind because those calf muscles, they look so sensual, right? When someone is wearing those high heels, so we are ready to compromise that. Well, it is true because whenever say the heel is high, those calf muscles, they will remain into constant tension, so they look more attractive, right? So that is true, but definitely it is at the cost. It is at the cost. So it though that affects the foot, right? Yeah. So this is navicular. After navicular, we have got three bones, and they are called as the cuneiform. Now just focus on this arrangement, right? Cuneiform. Cuneiforms are these bones, these bones, these bones. There are three cuneiform, right? One is medial, second is lateral, and there is someone who is in between. It is intermediate. It is intermediate, right? So these are the three cuneiform. In order to see cuneiform, this is not the correct angle. We have to actually rotate the uh, foot so that we can watch it from the top. Then and then we'll be able to see. Now count. This is calcaneum is one, talus is second, navicular is third, right? Medial cuneiform is fourth, intermediate cuneiform is fifth, and lateral cuneiform is sixth. But overall, there are seven these tarsals. So one is left out, right? And that is cuboid. Cuboid is the lateral most. So this is the medial view. You won't be able to see. So let's rotate and then see it. Here it is. This is the lateral view. How can we say that this is a lateral view? Because see, this is the little finger. This is the little finger, which we can see. Over here, right, this big toe was near to us. So that's why this was like a medial view, right? This is the medial view. And now, over here, this is a lateral view. We are watching from the lateral side, right? So that is, and wonderfully seen bones. I'll just mark 1, 2, and 3. I'll mark it over here. This is 1, this is 2, this is 3. And they are none other than the medial, intermediate, and the lateral cuneiforms. Cuneiform. Very nice, right? But it is the thumb side, then it should be tibia, means fibula, where, no, that is very high. This is right now, we are talking about the ankle, right? See, this one is calcaneum. This one is calcaneum, correct? This one is what? Talus, right? Because talus is in with the tibia. And this one in between, that is navicular, correct? Navicular. So 1, 2, 3, 1, 2, 3, 4, 5, 6, right? 4, 5, 6. And the seventh one, this big gentleman sitting over here, right? This one. This bone is cuboid, right? C-U-B-O-I-D. This makes our list complete of 7 tarsals, right? Now see their arrangement. They are arranged in such a classical way. Here it is. The real bone, the real ankle, right? Say the movements, the impact would be on talus, right? But that impact would be transmitted to calcaneum. Now, you know, when the planes, they fly, right? When they land, they don't land like this. The planes, they land like this, right? And so first their rear wheels would touch and then the front wheel would touch. You are getting it, right? So when they land, right, they will land like this and then it will go like that, right? So that's how they land. When we run, things are different. We land on our toes, right? And then we give a push. It has to be like that because we have got a very powerful spring action, that is our arch. So when we land on our toes, and then that toe would gradually the entire foot, and then we take a pump. Try to walk on heels for the practice, right? Walk on heels. Walk on heels. Heels, right? Try to walk on heels. So when you'll walk, it would be a superb exercise for your calf muscles, right? It would be an amazing exercise for you. And ballet dancers support all body weight on the tip of the toes without any that is by the practice, right? That is by the practice, really. It requires tremendous practice. Yes, there are for flat foot, there are exercises. So here is the talus, then this one would be navicular, right? Very clear, right? This one would be navicular. And these are what we are watching is those cuneiforms, right? Cuneiform. So this one would be the medial cuneiform, right? And the lateral cuneiform, intermediate and lateral will be on the other side. This is a real bone. Another view, just for the practice. Now you know it, right? This one is tibia, this one is calcaneum, that one is talus, this one is navicular, and these are the cuneiforms, right? And that one is metatarsal, and this one and this one, that is the phalanx or the phalanges. Boat shaped navicular. Very right, Shruti. That is a boat shaped. True. Right. Just one more view. But in this view, because this is like a real bone. Right? That's like a real bone. So what I really want that you just have a look at it and try to identify the structures. See here, this one is tibia, right? This one above is fibula, this one, right? What you are watching, that one is talus. Then this boat shaped, right? This, right? This one. So that bone is navicular. That's right. That is navicular. And then we have three cuneiforms. So it is like 1, 2, 3, right? And we name them, right? They are those three cuneiforms, right? You know the name: medial, intermediate, and the lateral. Here is one, that is the cuboid, correct? That is the cuboid. So on and just deep, what we are watching is calcaneum, right? So calcaneum 1, talus 2, navicular 3, 4, 5, 6, that is cuneiform, and last one, seventh, cuboid. Done. These are all metatarsals, right? In 5 and 14 phalanges, right? Because big toe will be having only 2 phalanges, right? Right? Just another angle which is telling that how closely things are associated, right? So here is the calcaneum. This one is fibula, right? This one is fibula, and this one is tibia, right? The rest of the bones, you know, right? This is talus, this is navicular, and these are all cuneiforms, and this one is cuboid, right? All good. This one, see the real bone. This is talus, and this one is calcaneum. Why they were separated? Just to show that, see the power of these bones, right? They are very tough. If in its reality, if you see this bone, right, it is pretty tough. It has to be. And it will be having so many ridges, it will be having so many prominences, because the muscles which will be attached over here, they will be actually giving support to the body. And it is this area, right, where the tendo-achilles tendon is there, tendo-achilles, right? So this area you will find quite rough, right? Quite rough, because it takes the pressure. And very beautifully seen the navicular, as you said very clearly, that it is like a boat, right? See, here is the boat. The only thing is our boat is like sideways. Just one more angle in which the I have removed this is real image, right? So over here I have removed the tibia. So that's where this top portion, right? This top portion, I'm highlighting it. This top portion is the portion where the tibia would be articulated. So this is a tibial articulation. This is for tibial articulation. So tibia will be connected over there. Right? That's the navicular, right? A boat shaped, and rest of the bones. Calcaneum, yes, you know now it very well. Okay. Question. Which side is this knee joint? Side determination. This side. Is it right or is it left? Hmm. Okay. Nice. Very good. Right? It is left. Because here is the tibia. Right? And we just see this image, and that's right. That's right. Right? That's the big toe. That's the big toe. Person is standing in front of us. So obviously this would be the left side. Very nice. Very nice. So eventually this was the last image. And once again, he's back with a smile, right? So that was about our journey of all the bones, right? Almost we have seen all the bones except some minor bones. But if you know these many bones, you are ready for learning any of the region, right? Huh. One email which was asked that in which order should we learn anatomy? Trust me, if you follow this order, right? Sometimes I feel bad when straight away head and neck is started in any of the college, or straight away the abdomen is started. Well, it's not good. I would insist that you guys have got time. So if not more, at least for some time, start spending some time on these regions in this order. Go at a high speed. No need to remember each and every thing. Just understand it and keep proceeding. Right? Order should be, if you follow this order, it's very good. First, you must learn upper limb. Right? I'll give you the reasons also why you should. Upper limb, because in upper limb, when it is said that, okay, this is biceps, acha, this is triceps, acha, this is brachioradialis, you will be able to feel those muscles, right? You'll be able to do those movements. You'll be able to feel that, acha, this is deltoid, right? This is anterior, this is middle, this is posterior. Yes, this muscle is this. This is the clavicle. This is how the, say, pectoralis major is connected. You'll be able to feel it. That feel is vital. When you learn upper limb, after that, you move to lower limb. Why straight away lower limb? Just one reason. One beautiful question which was asked is when we were discussing about greater trochanter and the lesser trochanter, right? Then greater tuberosity and the lesser tuberosity. The comparison, that is when you are when you have learnt upper limb and then when you learn lower limb, you'll be able to say correlate it so easily and you'll be able to absorb lower limb so beautifully. बहुत आराम से you'll be able to complete it. Yes, they are pretty homologous, right? After that, learn thorax. Yes, after that, learn thorax. Because thorax, there you will start getting the structures also, that is lungs, heart, right? And because it will be associated with the physiology also, so even that part would also be helping you a lot. But basically, when you will learn upper limb, lower limb, and then you get thorax, so you'll start getting that this is how the body is connected. After thorax, back to back, go for abdomen. Don't worry about head and neck, right? Go for abdomen and pelvis. When you do this, it will give you a complete picture that this is how, right from the above to below, everything is nicely connected. And then go for the all-time great head and neck. Head and neck is, I'll not say it is tough. It is amazing. It is just amazing. But the trouble is that in this much small area, so many muscles, so many structures, and in upper limb, everything will be like anterior, posterior. Most of the time, it would be like that. It is in head and neck, right, where you will get a 3D view, right? Because the structure is in center, and then you will be said that this structure, these are the structures which are above, these are the structures which are below, these are the structures which are in front, these are the structures which are in back, these are the structures which are on the medial side and the lateral side. So you have to understand it in a complete 3D, right? When you will be learning about the sphenoid bone, when you will be learning about those pterygoid canals, etc., right? It is so amazing. So it is this order. I teach in this order normally, right? So this is the order which I wish that everyone should follow. So it makes things much easier. And yeah, after then, the beautiful brain. right? Head and neck and brain. It is head and neck or headache? No, no, it is not at all a headache. It is head and neck, right? Very respectfully, it is head and neck. And once you understand it properly, right, you won't be having any headache, right? In fact, you will relish. Yes, I'll share this PDF just after completion of our session, just 10-15 minutes, right? So this is the thing. Yeah, we have got some time, so let's talk about that important question. Why exercise is so vital, right? Yes, tomorrow I will talk about even this super reading also. Bones are not brittle. As such, bones won't break. But if they become brittle, it's a problem because then they can fracture easily. As such, the bones are very tough. So what I was telling was that see, it is not so that testosterone and the estrogens, they are meant for only the sexual activity. No, they give muscle power, right? They give muscle power. They give you the fighting spirit. They give you the fighting spirit, whether male or female, right? It is same for everyone. That would be difficult. But see, don't worry. I'll send you the images separately. Don't worry, Yash. So let's talk about this. So testosterone and estrogen, as the age increases, right? Post 40, these levels they start dropping. And in case of females, so yes, you'll find that there would be changes in the cycles, right? The duration of cycles would change, and you know those things very well, right? You must have seen in the elderly people. But at the same time, you'll find that even in males also, uh, you'll find many of the males literally you'll find that are they devoid of testosterone, right? Their yes, their muscle power and everything is so weak. Yes, it affects, it definitely affects. So that's why if you don't take care of these hormones, right, the rest of the life is miserable. You'll be having enough money, but that money would be of no use. The idea is, it is, as I said, that fitness is an investment. Start investing today. It is like an investment, right? Take my word for it. It is like an investment. And then you will be so happy after years when you'll be having enough money, but you'll at the same time you'll be able to enjoy the life. Right? It is okay to have slightly less money, but your fitness level, if it is good, you'll actually be relishing, you'll be enjoying the life, right? This is very crucial. Just 20 minutes a day. I'm not telling you more, right? Even if you are very busy, even if there is a final MBBS exam tomorrow, right? Surgery exam, still you can manage 20 minutes, right? 20 minutes is not more. People give all sorts of excuses, right? I don't want that any of my student should be giving that excuse कि नहीं sir time नहीं है, right? That's why tomorrow we'll be talking about time management. Time management is like, it's not like say managing the time, but how smartly we handle our time. That's right. That's right. Testosterone and estrogen, they are present in both males and females. But in case of females, testosterone level is very negligible. And in case of males, estrogen level is very negligible, extremely low, right? The trouble comes when the testosterone level drops in case of male, right? So then that estrogen becomes powerful. And that leads to, say, decreasing male characteristics. Same way ulta in case of females, right? So that's why suddenly you'll find that there are so many changes. There are so many changes in the structure and the characteristic of that. Even the thought processes are affected by it, right? You'll find that they are all very sort of dhila persons. So that's why these are vital, right? These are vital. These are like God given gift. But then God has said that, okay, I have given you the gift. Now it is your responsibility how you take care of it. Say, for example, smoking, right? Alcohol. Those things, they are killers. They are killers. We can't replace our lungs कि चलो, right, कहीं से नए lungs लेके आ गए. No, you won't be able to do that. So preserve your body. The most important person in the whole world is you. You. You are most important. No one is as important as you. Take good care of yourself. Then and then you'll be able to take care of others. Right. So with this note, we finish the things for today. Right. I'll send this PDF within few minutes, and why in women after age 30 vertebrae bones start aging? Well, it is not exactly like at the age of 30, but the trouble is bad posture. Yes, seriously. At times, at times it is like we don't even know how to walk. Trust me, we don't know how to walk. We walk with hump. When we sit, so we don't sit straight, and we sit with the back which is having hump, right? And then gradually it leads to wedging. So all those vertebra which are so beautiful, but after certain, because of incorrect posture, they become like this. That is what is called as the wedging. So when the wedging occurs, when it breaks, so it leads to changes in the intervertebral spaces, and that leads to, say, all those intervertebral foramen, right? They start compressing, and then there is pain and whatnot, right? All those things, they occur, right? Well, that is again, uh, homosexuality and bisexuality, all the games, unbalanced level of hormones, right? Say, because this is a public platform, and now, so if in US, if you call any girl she, so, so, so yes, they don't feel good. If you call any male, right, a boy, he, so they say no, you can't do this. So that's why over there, to someone you have to take permission, that whether you would like to call yourself as he or she. Forget. Let's not enter into that, right? Very controversial. Yeah, I know. That's right. Can these hormones be provided artificially? Well, that is called as the hormonal replacement therapy, and there are so many side effects. The natural thing, no one can beat the natural thing, right? And say side effects, they are there, and once again, you can't continue it for long. After certain time, the one has to stop. No, no, no. Shreyas, let's not go into any of such discussion. Okay, so thank you guys so much, and we meet tomorrow same time, right? With as a free day, ne? Tomorrow will be the free day. All right. So we'll talk about lots and lots of things. Okay. Thank you so much, and see you tomorrow, and you'll get this PDF soon. Oh yeah, definitely. Thank you, and bye bye.